Okay, so for our data health analysis, we chose to look at Uzbekistan.
So first, we decided to look into the causes of premature death, and we broke those categories into 1990 and 2010 just to compare the data. And so in 1990, we found that lower respiratory diseases were the leading cause of premature death, followed by ischemic heart disease, as well as neonatal encephalopathy, compared to 2010, where lower respiratory diseases were also the most prevalent cause of premature death, followed by ischemic heart disease and stroke.
So some takeaways we've got from this data is that there's a decreased prevalence of lower respiratory disease and an increased prevalence of different vascular related diseases such as heart disease and stroke. And this is likely due to dietary changes that include higher concentrations of sodium and unsaturated fats in processed foods. And the improvements we see of respiratory diseases can be attributed to improvements in sanitation as well as the availability of medical resources.
And so just to kind of show all of this in a graph, it makes it easier to see kind of some of the trends. So so this graph is broken up into two different columns. The light green is 1990, and then the darker green is 2010. And so as you can see, lower respiratory diseases significantly decreased between these years. And that's mainly due to sanitation processes and improvements in medical technology, as well as availability and just simple education. So that's a really cool reflection of just healthcare on a global scale. Ischemic heart disease and stroke were seen to increase. And again, just to reiterate, some of the dietary changes, which reflect just eating larger concentrations of fast foods, unsaturated fat, as well as smoking and different lifestyle factors. And then neonatal encephalopathy was shown to decrease a little bit. And this is mainly a reflection, again, of improvements in healthcare availability. So those were some of the trends.
Next, we looked at the years lived with disability, and the top 5 include major depressive disorder, low back pain, iron deficiency anemia, neck pain, and anxiety disorder. So for the 1 to 4-year-old age range, the highest prevalence was nutritional deficiencies. We put this to education barriers and just not knowing the nutritional needs that the youth require to reach their specific growth milestones. And the lowest was mental, behavioral, and musculoskeletal disorders. For the next age range, we looked at 20 to 24-year-olds, with the highest prevalence being mental and behavioral disorders. And the lowest was chronic respiratory disease. And then for the 45 to 49-year-old age group, the highest was musculoskeletal disease, which comes from a lot of their jobs include physical labor. So it's just wear and tear of working, exerting your body. This contributes to the low back pain and the neck pain. And then their lowest prevalence was nutritional deficiencies.
And so looking at the disability adjusted life years in these two years, the 1990s through 2010. So some of the conditions that we saw that increased were diabetes, cirrhosis, and chronic kidney disease. And one of the trends that you see with these diseases, as vascular diseases increase, you get a lot of comorbidities. So for instance, with diabetes, especially type 2 diabetes, your blood is getting thicker and more sugary. And it really, if you think about it, your kidneys, just taking, for example, the chronic kidney disease, your kidneys are like the washing machines of your body. And if we're constantly bombarding them with thick, sludgy blood, we're going to find that a lot of that tissue will become necrotic, and just for constant overuse of our kidneys because of the thick, sugary blood. And so you see a lot of these different comorbidities with one diagnosis, such as diabetes. as well as cirrhosis. That's also another comorbidity, and it's also associated to increasing in alcohol use. And based on the research we did outside of this, just to kind of supplement and give us an idea of what was going on in this country, alcohol abuse and alcohol use was shown to be a trend. So those are some of the things that were increased between those years. Some of the things that decreased, though, were lower respiratory diseases, preterm birth, and neonatal encephalopathy. And again, that goes to show just some improvements that we've made in the availability of healthcare and simple sanitation processes, as well as education and just different availability. And with things like preterm birth and neonatal encephalopathy, that can actually be stopped and prevented if you decrease the risk factors on the maternal side. And so that's just an interesting reflection of advancements that have been made. And so finally, some of the risk factors for these things. Breaking it down to ischemic heart disease and stroke, a lot of the vascular diseases that we see, as well as the comorbidities. Like we've been saying, and just to reiterate, a lot of it comes from the food that we eat, as well as our lifestyle and things like that. And so with this culture, just to give you a little bit of an insight into this culture, they eat what's called halal food. And although it's rich in vegetables, it's also heavily concentrated on meats such as lamb and pork and things that are just high in fat. And so, and as we see as a global trend, there's just a lot more convenience food, processed food, fat food, fast food, which all contribute to these vascular disorders.
For risk factors contributing to lower respiratory disease is the close living quarters. Their cities are very heavily congested, and whole families are living together in small apartments with unsanitary conditions. And depicted in at the bottom is yurts, which is another living style where they travel through the desert and bring their houses with them and put whole families, like up to 10 to 15 people in here. So they don't have access to resources when they're living in the desert like this. And it's unsanitary conditions, and again, close living quarters, which all contribute to the prevalence of respiratory diseases. And then on this next slide, we have our references, and that's our presentation.